think that our vision not only empowers, but inspires. Every decision my team and I make, really we always go back to, are we working towards leading the nation in clinical outcomes? Are we working on leading the patient experience for those we serve? And are we really driving to the most affordable healthcare product that we can?
The vision of the Institute is that we try to provide the best possible medical care to all of our patients from the ground up. And one of the philosophies that we keep is that we don't just make babies, but we create families.
We believe in a whole person approach to patient care. By utilizing alternative healthcare methods such as chiropractic care, massage therapy, nutrition, diet, and exercise. We are empowered by watching our patients' quality of health improve by the services we provide.
Our vision at Hospice of Southwest Ohio, our success as a company relies on individuals who share our vision. Our team takes pride in knowing that they add value to the organization.
You know, I'm blessed to be able to work with a group of administrative and board folks who really understand and are committed to our mission. Our physicians, our clinical staff, the support people that help us to do what we do at the Christ Hospital is, in my mind, second to none. And out of my 34 years of being out of physical therapy school, I've never worked around a collegial group that works so diligently to make things happen in an incredible way.
I think all of us at Cincinnati are very fortunate to have world-renowned physicians, people who are leaders in research, leading clinicians who have published in books, journals, articles, have been leaders of the world in the anterior and posterior segment with respect to eye care. And so that kind of scenario with probably one of the top few largest institutes in the country leads to great innovation.
Advice that shaped me as a leader, a very wise person told me once early in my career that it's not about treating the patients and people the way you would want to be treated. It's about treating all people the way they would want to be treated. And that's really is an important differentiation because we can't take our values and portray them on how other people feel and receive and expect to be treated. Everybody has unique and individual value systems, and we need to identify those and really focus in on what we do to meet their needs, not our needs.
Well, I think my idea as a leader is that a leader should be a servant, and a leader, rather than someone who's control or empower, a leader should be someone who empowers others to accomplish great things, and a leader should be someone who gets people excited about what is possible rather than talking about what's impossible.
Fundamentally, there are a lot of different pieces of advice we can take, but one of the most important things is to understand that success is a choice, and that while we also may not be able to control everything that happens in our lives, we absolutely can control how we react to it. And so if we take it and learn from it, if we're brave enough to understand what's happening and fierce enough to make a difference, we can absolutely change our whole point of view and our whole perspective just by understanding how we look at things and understanding success is a choice.
The best advice that I've received that shaped me as a leader is from my mother. It may sound a little cliche, but she's always said, "Stephanie, put your best foot forward."
My mother always said to me, do your best to maintain excellence in all you do. Throughout my career, I have worked very hard in maintaining excellence.
Innovation and advancements in the field at Christ Hospital. We were the first in 1984 to do the first ceramic hip implant surgery. We were one of the first in the region to do minimally invasive hip surgery.
Well, I think you always got to be thinking outside of the box and what the next step is. So for example, back in the 1980s when people didn't use cell phones and doctors rarely used cell phones, we actually one of the first users of cell phones to deliver acute stroke treatment as part of a clinical trial here in Greater Cincinnati that led to the very first treatment for TPA. Just more recently, we've had the first in the United States variable care unit for patients with neurologic problems who are very sick. So a patient go into the unit, be in the critical care setting, move to a step down, and then move to just a regular floor bed, but without having to move, and having a room that's spacious where the family can be close and interact with them. And I think that's another way that I said we're moving the needle forward and we're making a difference.
At Owens Chiropractic and Rehabilitation Center, I think that we are making a huge difference in the field of healthcare by going out in the community and educating the community about more affordable and non-invasive options for pain management and spinal problems instead of the traditional medicine and surgeries.
A few years ago, I sat back and I thought, you know, what could I do as a hobby? And I was so mesmerized and amazed of magic growing up. And about 10 years ago, I started doing magic, and that was one of the biggest hits for our children that come back to the office to visit, and the children of our patients that come in with their mothers to see us. So is it a superpower? They certainly think it's a superpower.
If I had a superpower, I think it would be from The Incredibles. It would be what's her name? The Incredible Woman, where I can kind of stretch and really reach beyond where my arms length. My problem is I never feel like I have enough time in a day to achieve everything that I want to achieve. I think I'm typically my world's worst enemy. I criticize myself frequently, always self-evaluating and how I can do things better, and the ability just to be able to stretch a little bit further would be a great power to have.
What superpower do I possess? That's a great question. I can tell you that the one thing I've learned, and I don't even consider it a superpower, and this is from the heart, patients want to be cared for as patients, but also as people. They want you to touch, they want you to feel, they want you to have empathy for what their problem is. And if you connect with a patient in that way, that's a superpower.